Hi, my name is Rhonda Lawes, and we're getting ready to get started on this Facebook Live event on how to create an NCLEX study plan. Now, you're welcome to ask us any question you want about the NCLEX. There's more than just me on this event today, so there's lots of people here to help answer your questions. Now, how this starts in the beginning is I'm going to give you content, but feel free to add a question in at any time when you have it. So, just a little bit about the NCLEX. You probably know some of this, so it might be a little bit repetitive, but it's just kind of a repeat of what we're looking at. NCLEX is a computer adaptive test. So it is different, very different than anything you've taken in nursing school. So it can be anywhere from 75 to 265 questions on the test. Just kind of depends on how the test adapts as you go through. So how that works is in nursing school, if I sit down and take a test, if it's 75 questions, it's 75 questions. I get 75 questions and the person next to me gets 75 questions. But at NCLEX, your test is really driven by how you do on the answers. So when you answer a question, if you answer it correctly, there's a minimum passing level that you're trying to stay above. That's the line, and that's where everybody starts with question number 1. And if you answer that question correctly, it will give you a little bit more difficult question. If you answer it incorrectly, it will drop you below the line and give you a somewhat easier question. So that's one of the main reasons that the NCLEX is different than nursing school. Those tests undergo tons and tons of statistical analysis and review. Unlike our nursing school average tests, they have a lot more resources to make sure those test questions have been tested. And you know who tests them? You guys do. So of the 75 or 265, 15 of those questions are simply practice. Now, sadly, nothing comes up on the screen that says, you don't have to try in this one, it's just for fun. So you take every question as if it was the real thing, because it absolutely probably is. So when we're talking about a study plan, it's really an individualized plan that helps you be successful. And I want to consider things, the title of this is an individualized NCLEX study plan, because nobody has the same study plan as someone else. We all have different life events, different responsibilities. It depends what time of year you're graduating, what things are going on. Sometimes we have people that are graduating and getting married, or they're going on a vacation. Wouldn't that be awesome? Everybody needs a vacation after nursing school. But here's the first thing I want you to hear. Your NCLEX study plan doesn't have to wait to start until you graduate from nursing school. I want to talk about kind of how you're studying now, and then I'll talk about some strategies that will work both for you in nursing school and in NCLEX. So you can start applying things right now as we kind of get started. So if I say the word studying, that's usually a painful word for most people to think about. But here's what I want you to kind of start opening your mind up as we're talking about study strategies and actually digging into that content. I want you to understand how your brain works, and I want you to know that your leisure time is just as important as your study time. So what I want to help you do today is come up with strategies that help you get the most out of your study time. And then I want to encourage you that you need time to rest and refresh. And I'm going to explain to you the science behind that. One of my passions is educational psychology. I love learning about how the brain works. And so that's why I went back to grad school to really study more about that. So I know it probably sounds too good to be true, but I promise you that downtime is just as important as study time. It will help you in nursing school. It will absolutely help you on the NCLEX. I'm going to explain that to you. Okay, I don't think I've ever been through anything that's made me feel more like the slow kid than nursing school. Have you ever felt like that? Like, I think everybody else in the room is getting this except for me. So here's what I want you to see. If you're that one that it takes you a little longer to catch on to concepts, I want you to know that you're not the slow kid. Here's the good news. You're probably the most creative brain, because there's a couple of different types of learners. We're not talking about learning styles, but I want you to realize that there's hikers and there's race cars, okay? So there's some people that your brain learns like a hiker. As you're going along, you like to look at other things, you're learning other things, you're trying to put things all together, but it takes you longer to get to the destination. Race car drivers, they say a concept in class, they have it, boom, and they do well on the test. Sometimes they're those people that don't study very much and seem to excel at tests. Yeah, those are like people that can eat anything they want and not gain weight. We really try to not like them. But what I want you to hear, the hitchhiker or the race car driver. Both end up at the same destination. It's just their journey that's a little different. And along the way, the hitchhiker, that creative brain that's looking at everything on the way there, is really going to have a solid understanding. Because if I could show you the picture of a hiker, not a hitchhiker, of a hiker, they see the trees, they see the scenery, they see the things as they're going along. For a race car driver, it's a blur. They're just getting to the destination. So I want to talk to you about kind of how we're talking about mastery in study, not just memorizing things, not just learning items and concepts, but really understanding mastery, because that's the key to nursing school tests and NCLEX success, is really making sure that you have mastery of the concepts. Okay, so first takeaway point, you're not the slow kid. Test scores are just one way, sadly, that we measure things, but that doesn't define you as a person or the kind of nurse you're going to be. Because I know some great nurses that really struggle in school, but man, they stuck with it, they persevered, and they're fantastic nurses. And I also know some people that are super book smart. And honestly, if I ever woke up and they were taking care of me, I would pull my own plug. Okay, so that's not what defines a good nurse, is your score on nursing tests. But what does define a good nurse is someone who has a solid understanding of concepts and how they fit together, can recognize when a patient's in trouble, know what to do, and step in and help keep that patient safe. So here is the most important key to everything. It's patient safety. So I always teach students, whether you apply this to nursing school or when you apply it to the NCLEX, for this particular patient in this particular setting, what keeps them the safest, okay? That's pivotal. When you're studying, if you'll think through that concept, why does a nurse need to know this and how would it keep a patient safe? That's going to help your brain learn how to apply the information. Now, let me share one very simple strategy. It'd be great if you have a piece of paper and a marker or a pen, something to write with. And I want you to just make 4 columns across the top of your paper. Okay, so make 4 columns across the top of your paper. In the first column, I want you to label it diagnosis or procedure. So the first column, diagnosis or procedure. The second column, worst case scenario. The third column is a question. How would I recognize it? And the fourth column is, what would I do about it? Okay, now that sounds kind of weird, I know, but this is when you're organizing, and when what I'm helping you learn to do is how to encode information in your brain so you can retrieve it. So this is a really simple method where if you're getting ready for a nursing school exam or NCLEX, these are the things you want to know. Because diagnosis or procedure, that means if we've got somebody who's got CHF, or we've got somebody who's going for a CAT scan with dye, or we've got somebody who's had a ruptured ectopic pregnancy. Those are diagnoses, those are procedures. You want to boom, fast forward to the worst case scenario. So usually when I ask students that, I'll say, for congestive heart failure, what's the worst case scenario? And they usually say, yeah, dead. So what I'm wanting you to say is, okay, yeah, how did they get to dead? Okay, what got them to dead? So what are the worst case scenarios with CHF? So in the first column, I'd write CHF. In the next column, worst case scenario, I'm going to write down and synthesize, think in my brain, what are the worst things that can happen to somebody in CHF? Well, you know that edema is the big problem, but the biggest problem is pulmonary edema. So that in that column, I put worst case scenario is pulmonary edema. The reason pulmonary edema is a problem is because if my lungs are full of water, what happens is, okay, if my lungs are full of water, then it can exchange CO2 for O2. And the problem being there is now my brain isn't perfused, my kidneys aren't perfused, my heart isn't perfused. All those are going to be overwhelming issues. So worst case scenario, pulmonary edema. How would I recognize it? Well, how I recognize that a patient is in pulmonary edema, I can listen to their lungs for crackles. I can see it on a chest x-ray. I can look at ABGs. Those are all things that I would recognize. And that fourth column, what would I do? Well, then I go back through those signs and symptoms of what I would recognize. And I would think through, okay, how can I do to fix that? Okay, so I know that they're not exchanging CO2 for O2 well, so I'm going to give them oxygen. But first, even before that, I'm going to raise that head of the bed straight up, right? To get them in the best position to breathe. I'm going to put oxygen on them. Now I have this problem with fluid on their lungs, so I'm going to limit their fluid. I'm going to watch it. I'm going to give them some medication that will help pull fluid off. That would be like a diuretic, like Lasix. So if you can go through those concepts, look, it's just 4 simple columns. Look, I just did this, scribbled it for you so you can see it. The diagnosis or procedure is CHF. The worst case scenario was pulmonary edema. How I would recognize it is that I would listen to their lungs, listen to a chest x-ray, look at their ABGs. And then what would I do? Well, I'd raise that head of the bed, I'd give them oxygen and give them diuretics, and I'd put them, watch their fluid intake and output very, very closely. Okay, so how does this help me with a study plan? When you start organizing information in this matter, hey, this is going to help you supercharge your studying, because you see this column right over here? Those are actually nursing interventions. And the questions that students struggle with the most are prioritization. So for this particular patient, well, what's particular about them is they have CHF. What keeps them the safest is, man, if I see any signs of pulmonary edema, I'm going to do something over here that's going to deal with that. So that's one of the things that we get really confused on, because when you see the answer choices in an exam question, you see a really good answer, but it's not the topic of that question. So when you're preparing for finals or nursing school exams or NCLEX, if you will shorthand your notes in this manner, it's going to help you know where there's holes in your learning. See, because if I can't quote the worst case scenario for everything, diabetes, insulin, CH, any of those things, if I can't quote it, I'm not ready on that content. That's an area I need to fill in. I don't need to put a textbook cut and paste here. I just need to put key notes to remind myself that, like example, pulmonary edema is the worst thing that can happen. How would I recognize it? Short, short, short. The idea is you look at information, you synthesize it, you're telling your brain, let's get real familiar with this so we can retrieve it and remember it. So here's a really good strategy on how you can study. Whether you're the slow kid or the fast kid, race car or the hiker, that strategy works for everyone, because that last column, what would I do, are the nursing implications. And really, isn't that what we want all nurses to know? We want you to be able to walk into a room, recognize when a patient's in trouble, keep them safe by saying, wow, I recognize that you're in trouble, and I know what to do. That is the essence of NCLEX questions. That's how it is. That's what we're looking for this particular patient in this particular setting. What keeps them the safest? Okay, now I told you I would talk to you about why your downtime is just as important as your uptime, as your studying time. So one thing I want you to know, that there's a term called Einstellung. Sounds pretty cool, doesn't it? It just really means like I'm stuck at one way of looking at a problem. Have you ever had the experience in nursing school or even your other programs where you're trying to study a concept and you focus and you try and try and try and try and you just can't seem to get that concept? Well, we have a focused brain process and a diffuse brain process. So focused brain, think of it as like a pinball machine that has the little bumpers really tight close together, and a thought can get stuck in this one circular pattern when really the answer is kind of down here. So when I'm really focused and I'm really trying hard, sometimes you can try too hard. Now, occasionally the reason I'm trying too hard is because the test is in 6 hours and I'm not ready. So that's one thing. The best gift you can give yourself is consistency over time with studying. And I know that is a huge challenge in nursing school, yeah, pretty much, and life. But consistency over time is what's going to do it. So anger and frustration shut down your brain. You don't think better when you're frustrated and you're angry and you start telling yourself like nursing school is ridiculous. This is humanly not possible, which a lot of those thoughts are sometimes based in fact. I get it, but know that when you find yourself in that area, it's time to take a break. So when you're taking the NCLEX, I always tell students, you got to know when to hold them, know when to fold them. So when you are taking the test, when you feel your brain going south like that, it's time to just push back a little bit, close your eyes, picture another place, calm down, and then come back at the question, because you can get so locked in. If I told you the questions, if I actually went back to the students when I'm proctoring an exam at my own university, students come up and ask me a question about a test question, and that's when I know they are just stuck in focus brain, because if they weren't in a testing situation, the wording would be very clear to them, but in a testing situation and under stress, they're in that focus brain thing. So really what I do as a faculty, when they come to me that freaked out, I talk to them about something else, take their mind off it, just for a couple seconds to kind of refocus them and say, I know you have this. Just go back and reread that again and kind of help them do it. Now, if you want to understand the diffuse brain, think of the bumpers as being spread much farther apart, and the ideas can kind of bounce around in there. Here's an idea. Have you ever been in the shower? Yeah, I know it sounds like a personal question, but have you ever been in the shower and all of a sudden you're like, you're trying to remember something 2 days ago, or you wake up in the middle of the night and you're like, that's that actor's name, or that's that concept, or that's that thing. That's your diffuse brain at work. What you need to know is focus brain is good, and we have to use the focus brain. But when you step away from the content, when you allow yourself the time to step away from the content, your brain still keeps moving, but it's in focused brain mode no more. It's now in a diffuse brain where the ideas are moving around, and your brain can make even more neuronal connections and connect those synapses, and that's what you want. So that's why, here's what I recommend for part of your study plan. If you tell yourself, I'm going to study for 12 hours today, yeah, that really is humanly impossible. If you think nursing school is humanly impossible, that is humanly impossible to study for 12 hours straight or 8 hours straight. You may be in front of study resources, but nobody can actually do that. Now, sometimes I've heard faculty say, like, you have to look at this as a full-time job. You need to study 40 hours a week. Okay, that again, are you kidding me? That's really hard, but I think everyone can do 25 minutes at a time. So here's what I recommend. There's something called the Pomodoro Technique. And when I am putting off things that I don't want to do, this is what I do. Now you can find the app on your iPhone, Android, online. They're all free. But the Pomodoro Technique, that's Pomodoro, it's kind of big tomato timer. It means for 25 minutes, I'm going to focus on this. I'm not going to allow myself to be distracted. I'm not going to check my phone. I'm not going to get up and I'm not going to do on Facebook. I'm just going to be focused for 25 minutes because most of us can do 25 minutes. And then the timer goes off and you get to take a short break. So if you really want to get in the groove, that's how you get the best bang out of it. If you just give me 2 hours, that's 25 minutes study, 5 minutes off, or you can take 10 if you need to, 25 minutes study, 5 minutes off, 25 minutes study, 5 minutes off. When you hit that fourth rotation, you have to take a 30-minute break minimum. But I promise you, if you'll really do that and you just say, I have 25 minutes and I'm going to really focus on this content, you're going to get much more out of that. If you're a nurse or you've ever worked 8 or 12-hour shifts, you kind of know how this works. Because when you have an 8-hour shift, you stay on your stuff because you want to get out of there and get on time. When you have a 12-hour shift, sometimes you let things slide a little bit toward the end of the shift, and then you can really be in trouble. Well, the Pomodoro Technique helps with procrastination because let's face it, no study plan in the world is going to fix procrastination. We have to fix procrastination, but I read the coolest stuff about it. We have pain sensors in our brain and pain receptors in our brain, and the pain areas of our brain light up when it's something that we don't want to do, that we want to procrastinate, just like if I received physical pain. So why do we procrastinate things? Because we don't like pain. So we actively do things to try and avoid it. So a couple concepts I want you to be aware of when studying. Einstellung, that one where if you're trying too hard and you're frustrated and you're stuck in focused brain, you need to push back and think, go do something. Diffuse brain has nothing to do with nursing school. So whatever that is for you, the ultimate diffuse brain activity, naps and sleeping. That's the ultimate way to shut down. But go exercise, which I'm a huge fan of. It's hard work, but it's great for stress relief. And it actually increases your cognitive sharpness to go and exercise. Sit with a friend, watch a TV show, just go do something else for a break. Now you have to come back. That's kind of the key, but you can do that. But know that you reach a certain point where sometimes you should just go to bed and then make yourself get up early. I know nobody wants to hear that, but sometimes you push through and keep doing things at night and you get yourself even more confused. So those habits that come in, procrastination and making excuses on why you can't do this and you have the worst faculty ever. They're so mean. They're so hard. I hear you. Those are just based in fear. And as long as you can recognize this, that if you acknowledge that you're procrastinating, you've taken the biggest step in trying to fix that and trying to adjust it. And we all do it. I cannot tell you as a student how many times I have got something in right at the wire, especially if it was intimidating or what I did about it. But when I start feeling those symptoms of Einstellung, I'm going to back up. I'm going to value my diffuse time and know that I need to give myself enough time to prepare for a test by not procrastinating, by chipping away at it on a regular basis, that I have time to do diffuse brain things, because those are really important that I include those. Now, one of my favorite quotes is from Florence Nightingale, and it's for myself, and you might like it too. But Florence says, "I attribute my success to this. I never gave or took any excuse." That is really powerful. And I put it on my desk because I'm brilliant in making up excuses for myself and procrastinating. I am gifted. But as long as you can start to see that the procrastination that comes along with studying is usually based in fear or avoidance of pain, right? Those two things. If you say, you know what, here's what I want to tell you today for coming by and seeing with us, how you think about stress matters. You want to use the stress in nursing school to motivate you, not to discourage you or make you attack your self-esteem. So the stress in nursing school, if you can start to look at it like, hey, this should be hard because what I'm doing is amazing. I'm preparing to be a nurse who's literally going to be at the bedside saving people's lives by knowing what to watch for and what to do and how to intervene and know when my patients are in trouble. So that it's hard is okay. That doesn't mean I'm the slow kid. In fact, stop saying or thinking that you're the slow kid and you don't get it. Start thinking, I'm a creative one, so I kind of take a long time to get there, but I'm going to get there. You really can do this. If you've met the standards to get into nursing school, you're equipped to stay there and succeed. I know that there's things and hurdles that set you back and make you not feel like you can't do it, but you really can. And what I want you to hear is usually that procrastination is based in fear that says, I can't do this. I can't handle this. If I can't get this right the first time, then I must not ever going to. You are going to get it. You just have to sometimes, it takes a little longer. It takes a little more effort, but it's really okay. You're going to get there. So remember that procrastination pays can definitely drag us down. But I want to go back to that Pomodoro technique. 25 minutes on, 5 minutes off, 25 minutes on, 5 minutes off, 25 minutes on, 5 off, and then one more cycle of that, then take your big break. If you'll do that, and you will take notes in this manner with the diagnosis or procedure, the worst case scenario, how would you recognize it, what would you do about it, you're going to see a phenomenal difference in your study. Now, the lowest form of studying is highlighting and reading. What? Yeah. No, you have to read. I get it. And highlighting is not wrong, but it's not learning. In fact, sometimes students bring their books into me and I have to put sunglasses on because I'm like, that's not highlighting, that's coloring because it's so bright. But what you want to do is if you're reading and highlighting, it has a point, but you have to manipulate that information. Take what you read, put it in the 4-column format. That's really going to help you start to figure out why a nurse needs to know this, how it keeps a patient safe. Like for the CHF example, why does a nurse need to know that pulmonary edema is the worst? So he or she will listen to those lungs frequently. Because if I catch pulmonary edema, the earlier I catch it, the easier it is to resolve. And that's going to keep my patient safer and safer. Pomodoro Technique says, hey, listen, there's a lot of things in nursing school I can't control, but my quality of study, I can. So use that load a timer onto your phone or onto there's a web page for one too, and see, like, I can just focus for 25 minutes and give it my all. You're going to see a phenomenal difference, because there is a difference in your study strategies when you are looking for mastery and how you can put concepts together and apply them to different things versus just memorizing something for an individual nursing school exam. Okay, so we've got some tools for you, how to take notes, the Pomodoro Technique. Just so you know, none of us are as good at multitasking as we think we are. And the second thing, we're learning through the research that we can't keep as many things in our brain at one time as we thought we could. Now, with memory, you have a short-term memory, working memory, and long-term memory. So short-term memory has a very short life. That's why it's called that name. Pretty clever, huh? It's like Dory from Finding Nemo. She forgets everything, like the memory of a goldfish, right? You have to do something with that information. That's why reading and highlighting really doesn't cut it. What you need to be doing is, once you get it in a format that you have applied it, you need to quiz yourself and ask yourself questions. And that's really the crux of the Kaplan's method, the decision tree. Answering questions is what you need to have. We want to teach you how to organize the content you have in your brain to use it, but then use a decision tree on how to really gain skill and ability in breaking down those questions. So that short-term memory, you got to do something to manipulate it. That puts it in your working memory. We used to think that you could keep 7, Miller's Law said we could keep 7 pieces of information in there. Now we know it's really only about 4. So you have to start chunking things together, because the goal is to manipulate the information that you're learning and then move it to your long-term memory. Think of your long-term memory as like a big filing cabinet full of, like, the drawer is labeled, and then each individual file folder is labeled. So when you go to answer a question or take care of a patient, your brain knows exactly which drawer to open, which file folder to reach for, and to pull out to have the information. That's called retrieving. So we're talking about encoding and retrieval of information. Encoding means I'm putting it and organizing it in a way in my brain that I'll be able to remember it and retrieve it when I need it. So short-term memory is like Finding Nemo, Dory. Can't really keep her things. Working memory is like a juggler, but you can only keep really about 4 pieces of information. And if you use chunking, like grouping like items together, that's one strategy that can also help you do that in your studying. So the spaced repetition is also really important. So again, we're back to that issue of time. You need things over a period of time to really help you absorb that information, have your brain be able to make new connections with it, have you able to encode it and retrieve it. Okay, now let's talk specifically about NCLEX. Those are things that you can start doing now, and you apply those in nursing school. They apply also to your NCLEX studying plan, because we've talked about how you're studying now. Some of the biggest challenges with all of us, and myself as a student, procrastination, fear of failure, all those things kind of go along in that and how that goes. Finding it difficult to stay focused, getting stuck on a problem and getting that focus brain and not allowing myself time for the diffuse brain activities. So those are some real challenges. Taking my notes in a way that don't just copy what I've seen in a textbook, but they make me do something with it. And boy, I promise, if you talk to a faculty and said, hey, I'm really struggling with this concept of, of peripheral arterial disease, what's the worst case scenario? Most faculty be more than happy to talk to you about that, kind of help you clarify that if you bring them something. They don't want to have to just spoon feed it to you. They want to know that you've kind of put some effort in that too. But how do you get ready for the NCLEX? Okay, well, first thing, you need a study plan that's realistic. I'm always the one that sets this completely unrealistic personal goal, and then you can't keep up with it, and I get bored, and then I get depressed and discouraged. And I don't want you to do that. So what I want you to do first is to kind of shoot for what date you'd like to take the NCLEX. That's the first place that you start. Okay, now how do I pick that date? Well, I don't have my ATT. I don't know what. Okay, listen, you got to pick something to have a plan. Okay, so you want to look at, and I highly recommend, not just because I teach for Kaplan, you need to take an NCLEX review. It will give you the discipline, the focus, and the feedback. Because when you take an NCLEX review, it's like having a safety net. It's like learning to be a trapeze artist with a safety net right there. You walk through lots of questions. It's kind of working like I think of the Kaplan faculty is like a coach or a personal trainer. They're going to help you identify where your areas of challenge are and where your strengths are and help you focus on bringing those weaknesses up to the same level as your strengths. And you all have strengths, whether you believe it or not. So you want to kind of start with a date in mind and things that we look at. Now, if you do the Kaplan program, we have some tests that you can take that help you identify early where you stand. Kind of like benchmarking and knowing kind of where you are in the process. Some of you have some extra challenges. For those of you that English is not your primary language, you are amazing to me. I think that is so awesome. I only speak one language fluently, English, and sometimes that's debatable if I'm that articulate in it. But for those of you that are English as a second language and you're taking the NCLEX, you might need a little more time. For those of you, your moms or dads are responsible for another income as you're going through, man, again, my heart goes out to you. I did it as, 18 to 22-year-old, and I thought it was really hard. But you guys that are managing families and responsibilities and other jobs, give yourself a break. I know the bills are tight, but you might need to give yourself another time. Now, if you're somebody who has the privilege of, some other human doing your laundry and taking care of you and cleaning your house and all those things, responsibilities, and you can really focus, you don't have to worry about finding a babysitter, you can probably do it a shorter period of time. But in the Kaplan class, we'll help you pick a date, and then you work backwards. So I always have students bring a blank calendar to class, and I have them kind of pick a date. But roughly, there's some other things I want to look at first. First of all, what are all your responsibilities? How much time do you have available? Because some students are still working while they're getting ready for their NCLEX prep. And so it does take them longer because, I don't know about you, but I work a 12-hour shift. I come home. I'm doing really good to just, kind of keep moving. That's not why I'm cognitively really ready and bright and crisp. So what we do is we look at how much time they have, what are the responsibilities that they have. And then I have them mark off non-negotiables. Non-negotiables are, doesn't matter to me, no judgment, but it might be, hey, I'm getting married on this date. So I'll help you with the strategy on, okay, well, if you're getting married, you need days before where you're not doing NCLEX. And then if you are taking your NCLEX stuff on your honeymoon, we have far bigger issues than NCLEX going on if you're just married and that's what you're doing. So we'll teach you some strategies. Kaplan has a really cool Apple app for the NQ Bank where you can practice some questions, and I recommend that you do 3 questions a day. You can sneak that in, no problem, and use the decision tree. Just keep your head in the game. But here's my deal. Honeymoon or vacation, you either go or you stay home. But that is off limits for NCLEX prep because you just program that in. We'll give you plenty of time to get ready, but don't take your NCLEX up. You ruin everybody else's time that's on vacation with you, and you're not really going to study. Otherwise, why are you going on vacation? So then all you end up with is more guilt and feeling like a failure. So don't set yourself up for failure. Use our quick method of just doing like 3 questions on the app. Keep your head in the game. Won't take away from your vacation. And we pick your date based on that. So you've got an incredible, people like these vacations are almost jealous of like a European vacation or a honeymoon or any of those things. Do it and do it right. We'll help you program that in to your NCLEX study plan. Now, maybe you have a day of worship, whatever your faith is. There's a day of worship that is Sabbath, or those are off limits. Then you mark X's through those. Maybe your day of worship is Friday night out with friends imbibing of things. That's fine too. It doesn't matter, but just be honest. Know that this time I need it off. See, that's diffuse brain time, and I'm all about that. So you mark off all those non-negotiable dates and things where listen, I've got 5 kids and they're all in the house. There's no way I'm going to be able to study. Those are times when you can't. So first of all, you lay that out. We put down all the non-negotiables. Then you pick the end date, and then we'll show you how to walk through setting up a study plan. Here's what you need: that calendar, and you need accountability. Because the most important thing when I'm a study plan is to have a plan. Because good intentions, I'm brilliant at those, but those don't help me get toward my goals. So what you need is a study plan laid out on a calendar. We'll walk you through how to do that. You need accountability. So that way, I'm not saying that you'll follow your study plan perfectly because none of us are perfect. But at least when your friend calls and says, hey, you want to go see a movie, you look at your study plan and go, you know what? I really do need some downtime. That is going to make me X number of questions behind, X number of whatever behind, but I think it's the best choice for me, at least you're making an informed decision. And that's what we want you to do. We know you're human. We know you run out of energy. We know you're cognitive, but at least you're making a decision versus not really nailing down what you're accountable to. So when someone asks you to do something else, you just run off and do it. Or listen, I don't even need someone else to distract me. I can be at the computer feeling like Cinderella and everyone else in the world is having fun. And then I think I need to organize my sock drawer, or I need to make my own marshmallows. Suddenly I become Martha Stewart. So one of your study strategies needs to be keep a pad by your desk, write down these incredible projects that you're thinking about to do, to try to distract yourself from studying. Then after you're done studying, you've got your break time, see if you really want to do any of those things. I rarely do. I usually just want to do those things because I don't want to study. But do that. Make an informed decision, have a plan, and we'll walk you through, if you use the Kaplan curriculum, we'll walk you through how many Q-bank questions you should do, when you should do your question trainers, which are already set for you, and how you're studying. Now, once you've kind of laid that out, you just have a plan. When you are answering NCLEX questions, and that's the best way, don't try and keep shoving more content randomly in your brain. That doesn't make sense. What you want to do is target the content that you do put in your brain and put it in your brain in an organized manner. So you answer questions, you take the practice questions, the Q-bank, the question trainers, and then you go back and look at rationales. Now, when you look at a rationale for a question, you always want to have rationales for the right and the wrong answer. I want you to have a notebook that becomes your NCLEX notebook. So it lives with you until the day you take the NCLEX. You could start working on it now even. And what I want you to do is if you pick up something in a rationale, right or wrong answer, just write yourself a quick note in your notebook. One of the best ways for you to retain information in nursing school, it's called spaced repetition. Go to class, review those notes quickly after class. That's when your brain is going to start really encoding. Then review them every day, and then gradually you can space out that time, and you're going to have that, boom, information locked in. For NCLEX, when you get information from the rationales, both the right and the wrong answers, you write it in your notebook. Part of your everyday study plan is to review your notebook for 10 or 15 minutes a day. Keep your notebook with you. If you're someone who has to wait in line, I do not like to wait in line. But if you're somebody who is wait and you've got some downtime, you might be a parent with a kid at practice, you might be standing in line at the post office, Lord knows you can grow old there. Whatever you're doing, if you have that notebook with you, just pull it out, look at some of the things, and ask yourself those two questions. Why would a nurse need to know this? How would it keep a patient safe? So that notebook, using those concepts of what we know about the brain, how it works, how it encodes, how it retrieves, writing those down, it takes your brain to process, to know what you're going to write short notes. Do not take a textbook and recopy everything it says. The process of putting that in your own words and looking for priorities is what really helps your brain start to learn the information and make those new neuronal connections. That's what you want between the synapses, man. You want those to be connected, those pathways to do in there. So when you're making a study strategy, let's review. You need accountability. You need to know that it's going to be a challenge, but if you follow a plan, the majority of the time, you're going to see phenomenal change. I highly recommend the Pomodoro method, where you do the 25 minutes on, 5 minutes off. You're like, that's not enough. Try it. 25 minutes can seem like a very long time sometimes, but really commit to doing that. And then have that calendar where you have laid out a plan on what you're going to do. And all along the way, you should be able to see periods of growth and progress. In addition to those study days, you're going to do days where you do a specific trainer test or a Q-bank question. You're also going to have days where you just look at content, but you only go after the content that you're weak in. For NCLEX studying, you don't study based on what you already know or feel comfortable with, or just try to study everything, or get some review book and try and, even the Kaplan review book is really good. It's kind of condensed version, but you don't want to read that cover to cover. You want to target that, because even if you're capable of reading that book cover to cover, it's really tough to process all that information, keep it in a way that you can retrieve it. So when you think about what I have, I'm going to really have and know how to apply and to use it. Okay, so in review, Let's think that, hey, some of us are hikers, some of us are race car drivers, but everybody gets to the destination. It just takes, the journey looks a little different. And the more you can apply information that you learn in one course or one class or one experience to others and see how they all connect, that's going to make you an even more effective nurse. For study strategies, know that focused brain, when you get Einstellung, it's time to back up. It's time to take a break. So do what it takes in your world to have the flexibility to take a break. You want to make sure you have plenty of those diffuse activities in addition to the focused activities, so you can learn them. If you want to know more about that, you just give me an email. I can talk to you more about that. And make sure that you're using practice repetition, that you're reviewing content regularly and consistently, and that will help you be able to recall the information when you want to, because you've got short-term memory, working memory like a juggler, and then that long-term memory you retrieve things from. For an NCLEX individual study plan, you want some system that shows you where you are by answering questions. Kaplan is an example of that, where it gives you reports and feedback that says, hey, you're doing great in this NCLEX content area, which is usually different than nursing school. You're doing great in this content area, but here's another NCLEX topic content area you might want to dig down deeper in. So you need a calendar. You need that plan, and you need that accountability that says, I'm going to go after my weakest areas because I want to get the most out of my study time. Well, hey, thanks for hanging with us today. If there's any questions you have, please feel free to post on the Kaplan. They are awesome about getting back to you. Good luck to all of you, and I hope we'll catch you together soon. Bye.